Hello everyone, welcome back to my channel Mis.Medicine. If you are new here, subscribe to the channel. This is Dr. Garima and this is series of the 20th notebook and part 6. So let's get into it. Next sign is the bowler's head sign. Synonym is double ring sign, a radiological sign which describes the appearance of a gastric pulp seen on position in a double contrast barium meal study. There will be a central lucency with two rims of barium around may also be seen in cases of sessile intestinal polyp or a diverticulum. Next is the Boyce sign, a gurgling sound heard on pressure by the hand on the side of the neck in case of esophageal diverticulum. Bozzolo's sign, a visible pulsation of the arteries in the nostrils, a sign believed to indicate the presence of aneurysm of the thoracic aorta. Branham sign, synonym is Nicoledoni sign. This sign is elicited when arteriovenous fistula is suspected. A pressure on the artery proximal to the fistula will cause reduction in size of the swelling, disappearance of bruit, fall in pulse rate, pulse pressure returns to normal. Next is Brody's sign, a black spot on the glans pallidus, a sign of gangrene due to urinary extravasation into the corpus spongiosum. Next sign is the bald fundus sign, a radiological sign described for atrophic gastritis. The fundus of the stomach looks like a small dome with absence of mucosal pattern indicated by a very thin smooth appearing gastric wall. Bent inner tube sign, a radiological sign described for sigmoid volvulus. An important diagnostic sign, a plain X-ray abdomen taken in the supine position which reveals a massively distended haustral sigmoid colon arising from the pelvic loop. Next sign is the bird of prey sign, a radiological barium anemia, sign which helps in the confirming the diagnosis in doubtful cases of sigmoid volvulus. Barium anemia reveals a smooth tapered narrowing at the point of torsion of the colon because the folds shows a screw pattern around the point of twist. Sign is the border sign. Describe the appearance of the ventral hernia in barium study follow through done in suspected cases. In the postoperative period, lateral and inferior border of the hernia are sharply outlined while the medial and upper border blends with the abdominal shadows. Cardraley's sign. Transverse pulsations in the laryngotracheal tube in the suspected cases of aneurysms and dilatation of the aortic arc. Chvostek's sign. Chvostek's sign, Weiss sign, excludes sign. Clinical sign typically describes for hypocalcemic tetany. The sign is elicited by the tapping over the muscles or superficial nerves to induce the muscle spasm. It may be facial sign and peroneal sign. Facial sign, a light tap over the facial nerve branches in front of the earlobe causes muscular twitching over the whole of that side of the face. Peroneal sign, tapping the peroneal nerve near the tubular neck. Next is the peroneal sign. Next is the peroneal sign. Tapping the peroneal nerve near the tubular neck will cause dorsiflexion and abduction of the foot. Next is the cobra head sign, adder head appearance. A radiological sign seen in cases of ureterocele, congenital dilatation of lower end of the ureter. Urography done in suspected cases produce a characteristic appearance which resembles a cobra head and hence the name. Crescent sign. A radiological sign describes the relation of two different conditions affecting the lungs and the kidneys. In plain chest X-rays taken in a patient suspected of hydrated disease or aspergilloma, fungus ball of the lung reveals a crescentic air in the show of partially ruptured hydrated cyst or in the cavity containing fungus ball. On IVP, the nephrogram reveals a crescent sign in cases of congenital hydronephrosis. Next is the Cullen's sign, synonym of the Cullen-Hofstadter sign, a clinical sign which was typically and initially described for ruptured ectopic pregnancy, wherein there is discoloration ecchymosis of the umbilicus and the surrounding skin are typically referred to as umbilical black eye. It is due to hemoperitoneum and may be seen in the conditions like ruptured ectopic pregnancy, acute hemorrhagic pancreatitis. Next is the Karman sign. It is also known as Karman-Kirklin meniscus sign, a radiographic sign helpful in the analysis of gastric ulcers in barium meal study. It is a reliable indicator of the malignancy. Non-projecting ulcers lying intraluminal in all the projections surrounded by an elevated rim of the tumor produces a curval interface resembling a meniscus and is called Karman's meniscus sign. Whether the meniscus is a convex or concave towards the lumen is mainly dependent upon the site of the ulcer in relation to incisura angularis. Meniscus is concave towards the lumen in the cases of the ulcer being proximal to the incisura, while it is convex when the ulcer is distal to the incisura. Next sign is the Carnot sign, a clinical sign which helps to differentiate the plane of the abdominal swelling. The abdominal wall muscle is made tense by asking the patient to raise both the legs with knee extended. If the lump is intraperitoneal, it disappears or becomes less prominent, while it becomes prominent or persists when the lump arises from the abdominal wall. Next sign is the coiled spring sign, a radiological sign barium enema classically described for intussusception. The passage of barium beyond the apex of the intussusception into the intussusception gives a colloid spring appearance. The sign may also be seen in cases of post-traumatic hematoma of duodenum, acute appendicitis, mucocele of appendix, endometriosis of appendix, intestinal carcinomas. Colles sign, a radiological sign barium meal follow through reveals deformity of the duodenal contour in the presence of the duodenal ulcer. Colon cutoff sign, a radiographic sign of the appendicular perforation or colonic spasm, absence of gas and faces in the right lower quadrant reflects dilatation of transverse colon and sharp cut of gas at the hepatic flexure. This sign is also seen in acute pancreatitis. Cooper nail sign, ecchymosis on the perineum and scrotum, labia, sign of fracture pelvis. Kopp's sign, also known as SOS sign. Clinical signs which are relevant in cases of acute appendicitis. This has two tests, Kopp's SOS test and Kopp's obturator test. In Kopp's SOS test, acute appendicitis, there is SOS muscle spasm secondary to the inflamed organ and hence the patient keeps the thigh in a flexed position. This can be aggravated by passively hyperextending the hip joint which stretches the psoas muscle. Kopp's obturator test. Its principles are the same as above except the muscle involved in obturator internus which is passively stretched by the internally rotating the right leg which is flexed at the hip and the knee. Next sign is a cupola sign, a radiological sign helpful in the diagnosis of the pneumoperitoneum. A plain X-ray abdomen in the erect position reveals gas under the diaphragm when there is relatively large amount of air in the peritoneal cavity, cupola sign. Next is the Crowfoot sign, synonyms as the Mercedes-Benz sign or Siegel sign, a radiological sign which is described in relation to cholelithiasis, gallstones. Nearly 80 to 90% of the gallstones are radiolucent, with only 10 to 20% being radiopaque. However, rarely a non-opaque gallstone can be diagnosed in pain radiography by the presence of the gas-containing surfaces within the stone. This radiolucent surfaces gives the appearance of the crowfoot, hence the name crowfoot sign, Mercedes-Benz sign, or the Siegel sign. Courvoisier's sign. In the patient with obstructive jaundice, if the bladder is palpable, it is not the dull. It is not due to the gallbladder stones. Next is the Cohen's sign, a clinical sign elicited in cases of Graves' disease in response to a light shown on one eye. There is jerky constriction of the contralateral pupil. Next is the Crow's sign, refers to the axillary freckling seen in neurofibromatosis. Crow's sign of the Saphina varix, a clinical sign elicited in cases of the varicose veins. Saphina varix, a thrill test is felt over the Saphina varix when the patient is asked to perform a Valsalva maneuver, cough in an erect position and is due to a jet of blood entering and filling the pouch. Next is the Coleman's sign, helps in the clinical evolution of fractured mandible. There is obvious swelling and bruising over the bony injury and a hematoma in the floor of the mouth if the body of the mandible is fractured. Meniscus claw sign, a radiological sign, barium study diagnostic of ileocholic intussusception. The barium in the intussusception is seen as a claw around the negative shadow of the intussusceptum. Coffee bud sign, it is a radiological sign seen in the volvulus of the sigmoid colon. Dalrymple sign. It is one of the manifestations of the Graves' ophthalmopathy. It consists of retraction of the upper eyelid so that the palpebral opening is abnormally wide and upper sclera is visible. Next is the Dalbert sign, a prognostic indicator in cases of the aneurysm of the main artery of the limb. If the nutrition of the part distal to the aneurysm is maintained, then the collateral circulation is said to be sufficient even though the distal pulse is not felt. Next is the Demoset sign, rhythmical jerking movement of the head with each heartbeat and is seen in cases of aortic insufficiency and aortic aneurysm. Demoset sign. Next is the dance sign, also known as sign de dance. A feeling of emptiness in the right iliac fossa, a sign of intussusception. Next is the De Moros sign, fixation or lowering of the larynx during phonation and deglutition, a sign of the syphilis of trachea. Dew signs, a clinical sign described in relation to the diaphragmatic hydrated abscess beneath the right cupola of the diaphragm. The area of the resonance moves chordally with the patient in knee elbow position. Next is the Dixon-Mann sign, also known as Mann sign. In case of Graves' orbitopathy, the two eyes appear not to be on the same level. Next is the Dordorf sign. The sign identifies the fullness of the supraclavicular groove on one side in the aneurysm of the aortic arc. Double bubble sign, a radiological sign described in cases of duodenal obstruction. This is the important sign which comes many times in the exams. A plain X-ray abdomen reveals two foci of a gas, one in the stomach and the other in the duodenum. A sign of the duodenal atresia, similar feature is observed in the fetus in ultrasonography done in the antenatal period. Next sign is Drummond's sign, a whip sound heard over the open mouth during respiration in cases of aortic aneurysm. Next sign, DTP sign. Synonyms: distal tingling on percussion, antenal sign, formication sign. A prognostic indicator which is helpful in the evaluation of nerve recovery following nerve injury. If percussion over the site of the nerve injury causes tingling sensation in the distal end of the limb, it suggests that the nerve injury was a partial one or it heralds the recovery from the nerve injury, a good prognostic sign. Next sign, Dubois sign, shortness of the little finger in the congenital syphilis. Next is the Dutchness sign. This is clinical sign identifies the sinking of the epigastrium during inspiration. It is classically seen in cases of paralysis of diaphragm and in certain cases of hydropericardium, pericardial effusion. Next sign, Dupuytren's sign. It is described in two conditions: a crackling sensation on pressure over a sacrometas bone. In congenital hip dislocation, it refers to free up and down movement of the head of the femur. Next is the dot sign. It is helpful in differentiating pain due to acute appendicitis and basal pneumonia with pleuritic. Compression of lower thorax from side to side elicits obvious distress when the lesion is above the diaphragm, whereas in appendicitis it has no effect. Next is the dock sign, a radiological sign described in relation to coarctation of aorta. A chest X-ray PA view reveals rib notching on the inferior margins of third to ninth rib while sparing the first two ribs and is indicative of collateral circulation developed in coarctation of the aorta. Sorry, if you want images PDF or images video, you can write me in the comment so I will upload that also. Next is the DV's sign, a clinical sign helpful in cases presenting with a history suggestive of intermittent claudication with palpable peripheral pulses. The patient is asked to exercise by walking or running sufficiently to bring on the pain. If prompt re-examination reveals absence of peripheral pulses, it suggests that the pain was truly due to intermittent claudication. Next is the echo sign, a percussion sound resembling an echo which is heard over a hydrated cyst. Next is the ileoid sign, refer to presence of indurated edge of a syphilitic skin lesion. Next is Next is the endoth sign, identifies the abnormal fullness of the eyelids, a manifestation of Graves' orbitopathy. Asterisk sign, described in the relation to tetany, where percussion of the inner surface of the lips or tongue produces contraction of lips, tongue, and masseter muscles. Next is the Ewart sign. It is said to be positive in cases of pericardial effusion if there is bronchial breathing and dullness on percussion at the lower angle of the left scapula, and it is due to the pressure and collapse of the lingular lobe due to enlarged pericardial sac. Next is the E sign or reverse 3 sign, a radiological sign seen on barium swallow radiograph in patients suspected of coarctation of aorta. It is due to the indentation produced on the barium-filled esophagus by the aorta. Next is the figure of 3 sign, a radiological sign seen in the plain chest X-ray PA view in patient with coarctation of aorta. Next is the Frostberg sign, a radiological sign seen in the barium study in carcinoma of the head of the pancreas, which involved the duodenum. In carcinoma head of the pancreas, there is widening of the C loop of the duodenum, and with the involvement of the ampulla of water, the expanded loop assumes a reverse 3 configuration, Frostberg sign. Once the carcinoma of the head affects the duodenum, the surgical cure is remote. Next is the Fox sign, discoloration near the inguinal ligament, seen in few cases of hemorrhagic pancreatic. Nowadays आई एम डूइंग 75 हार्ड चैलेंज. उसके रूल्स कुछ अलग हैं और मैंने अपने रूल्स बनाए हैं ताकि मैं अपने अच्छी से स्टडी कर पाऊँ और एग्जाम के लिए प्रिपेयर कर पाऊँ. यू कैन ऑल्सो watch that videos too on Instagram. ID is Dr. Garima Gajwani. So the next sign is closed leg test. This sign is more relevant when popliteal artery is not clinically palpable along with the absent distant pulses. The patient is made to sit with his legs crossed. Normally, oscillatory movements of the foot occur synchronously with the pulse if the popliteal artery is patent, while a negative result is more suggestive of popliteal artery blocking a patient with absent distant pulses. Next is the Frederick sign, an interesting sign described in relation to pneumoperitoneum. Due to intestinal perforation, wherein an auscultation of the abdomen, the cardiac sounds can be heard. Flush tank sign, a clinical sign described in relation to hydronephrosis. The patient classically present with features suggestive of Diethel's crisis, that is, passage of a large amount of urine with consequent disappearance of a lumbar swelling. Flush tank sign. Next is the flared sign. The precursor of varicose ulcer is a splay of fine venules that courses from the medial malleolus and spreads out to be the lowest beneath the thick skin of the heel and is known as the flare sign. Next sign is the Gifford sign, a clinical sign which helps in the differentiating unilateral exophthalmos and proptosis due to infraorbital tumors. If the upper eyelids cannot be easily everted on the affected side, the exophthalmos is more likely to be due to thyrotoxicosis, and whereas if the lid is easily covered, it is more likely due to an intraorbital mass. Next is the Gray Turner sign. Skin discoloration, bruising in the left flank, left costovertebral angle in cases of acute hemorrhagic pancreatitis. Next is the Gilbert sign, opisuria indicative of hepatic cirrhosis. Opisuria means excretion of urine more rapidly during fasting than after a meal. Next is the Glasgow sign, a clinical sign presence of systolic murmur over the brachial arteries found in latent aortic aneurysm. Next is the Griffith sign. It is one of the clinical signs of Graves' orbitopathy wherein there is lower lid lag on upward gaze. Next is the Guyon sign, ballotment and palpation of a floating kidney. Next is the Gore sign, a clinical sign seen in femoral hernia, distension of superficial epigastric or circumflex iliac veins on the affected side due to pressure on the vessels by the hernial sac. Next is the Goren sign, hematoma at greater palatine foramen seen in the maxillary fracture. Homan sign, pain on sudden dorsiflexion of the foot, a sign of deep vein thrombosis of the calf veins. Next is the Hamilton belly sign, a clinical sign described for intussusception, a sausage-shaped mass with concavity towards the umbilicus which is felt to harden as a wave of peristalsis commences. Next is the Hall sign. This sign identifies a tracheal diastolic shock felt in the aneurysm of the aorta. Next is the Hitchcock sign, refers to the tenderness towards the angle of the jaw in mumps. Hodek sign, radiological sign identified in barium meal X-ray done in the patient suffering from gastric ulcer. It describes a projecting shadow in radiographs due to settlement of barium in pathological niches of stomach wall. Next is the Hitzelberger sign, a clinical sign described in case of acoustic neuroma, wherein this is anesthesia of medial, posterior, and superior areas of the external auditory canal because of the tumor tissue compressing on the facial nerve. Next is the hook sign. This clinical sign identifies flexion of the fingers in case of acute suppurative tenosynovitis. Next is the horn sign. This sign identifies the pain produced by traction on the right spermatic cord in acute appendicitis. Next is the Hauschip-Rumber sign, a clinical described in the patient suffering from obturator hernia. The patient complains of pain passing down the inner side of the knee due to pressure on the obturator nerve by the hernial sac. Next is the Harvey's sign. Two index fingers are placed by the side of a vein. The fingers are now pressed firmly and the finger near the heart is moved proximally, keeping the steady pressure on the vein so as to empty the short length of the vein between two fingers. The distal finger is now released. This will allow venous refilling to be observed, which will be poor in ischemic limb and increased in arteriovenous fistula. Next is the Hammond sign, Hammond's mediastinal crunch or murmur. Clinical sign, precordial crunching, clicking or knocking sound synchronous with each heartbeat, heard on auscultation in conditions such as acute mediastinitis, pneumomediastinitis, and pneumothorax. Inflammatory signs, cardiac signs and inflammation, rubor redness, calor temperature, delor pain, tumor edema swelling, and functional LASA, loss of function. Next is the Gendrastic sign, paralysis of the extraocular muscles, a manifestation of Graves' orbitopathy. Next is the jugular sign, on spinal canal block. When pressure is applied over jugular veins in the manometer connected to LP needle, either pressure will not raise or if raises fall slowly. Next is the Joffre's sign, absence of wrinkling of the forehead when the head is bent down and the patient is asked to look upwards, a sign of Graves' ophthalmopathy. Next is the Cunning sign, a sign which is positive in meningitis. With the hip flexed, the knee is extended normally if it can be done up to 175 degree. In meningitis, it is restricted due to the spasm of the hamstrings. Next is the Kaposi streamer sign, failure to pick up or to pinch a fold of the skin at the base of the second toe. It is characteristic of the lymphedema. Next is the Kocher sign. It is also known as Means sign, a sign of the Graves' orbitopathy. The examiner places one hand on a level with the patient's eye and then lifts it higher. The upper eyelid sprints up more quickly than the eyeball. Next is the Canaval sign. His sign is useful in the diagnosis of the ulnar bursitis. In case of the ulnar bursitis, is the site of the maximum tenderness is over that part of the ulnar bursa lying between the transverse palmar creases. Next is the Cantor sign, string sign of the Cantor, a radiological sign described in barium anemia, follow through in patients suffering from the Crohn's disease, a string-like configuration of contrast material through a filling defect is seen in radiography. Next is the Caher sign. This sign identifies the pain is elicited in the left shoulder in patients with suspected splenic rupture. The referred pain experienced by the patient is due to blood in the peritoneal cavity, which irritate the diaphragm. Next is the Clam sign. It is a radiological sign found in the chronic appendicitis where there is often an indication of tympanitis in the right lower quadrant. Next is the knee sign. Unequal dilatation of the pupils, a sign of Graves' orbitopathy. Krasovsky's sign. Cicatricial lines radiating from the mouth in congenital syphilis. Next is the Kinos sign, a clinical sign usually associated with biharzial fibrosis of the liver, Egyptian splenomegaly, but may be present in any type of portal hypertension. Auscultation over the Seifert process reveals a venous hump splenic vein engorgement, which becomes prominent on inspiration. Next is the clean sign of shifting tenderness, a clinical sign useful in acute non-specific mesenteric lymphadenitis. When patient is shifted to left lateral position, point of the maximum tenderness also gets shifted to the left side in contrast to acute appendicitis. It may also be positive in Meckel's diverticulitis. Lemon sign, a radiological sign of Arnold-Chiari malformation. There is scalloping of the frontal bones, giving the skull a lemon-shaped configuration in sonography of the fetal skull duration, second trimester of pregnancy. Next is the Lanoff sign, a furrow appearing on deep inspiration below the lower rib and above an echinococcal cyst of liver. Sign of lesser triad, sudden appearance and rapid increase in size and number of seborrheic keratosis, a sign of internal malignancy of the GIT. Leod sign, a clinical sign elicited in a patient with renal calculus, pain elicited in the loin on deep percussion over the kidney even when there is no pain on applying deep pressure. Next is the London sign. It is useful in the ruptured intestine suspected in an accident case. The presence of the pattern of the bruising of the skin, an imprint of the clothing is noted on the skin. It indicates that a crushing force has been applied sufficient to rupture the bowel against the vertebral column. This sign is a strong indication to carry a laparotomy. Do subscribe the channel if you like this video and do share to the needy one. Next is the Mallet-Guy sign, a clinical sign identified in chronic relapsing pancreatitis. It is elicited by placing the patient in the right lateral position with the patient's hip and knee flexed and deeply palpating the abdomen in the epigastric and the left subcostal region. This will evoke tenderness in chronic relapsing pancreatitis. Next is McBurney's sign. Fingertip pressure is made over the McBurney's point, elicits severe tenderness in patients with appendicitis. Next is the Murphy's sign. The clinical sign is classically described in patients suffering from cholecystitis. It is elicited by the asking patient to breathe deeply while exerting moderate pressure with the left hand such that thumb lies over the fundus of the gallbladder. The patient catches his breath as the inflamed gallbladder, which is pushed down by the diaphragm, gets imposed against the thumb. Next is the McEwen sign, a clinical sign elicited in children with hydrocephalus on percussion of skull behind the junction of frontal, parietal, and temporal bones and auscultation over opposite mastoid bone. There is more resonant note than normal, seen in internal hydrocephalus and cerebral absence in children. Next is the Mebius sign, inability to keep the eyeballs converged due to insufficiency of medial rectus muscles, a clinical sign of Graves' ophthalmopathy. Next is the millions ear sign, a clinical sign which is useful to differentiate facial erysipelas from cellulitis. Erysipelas being a cuticular lymphangitis spreads from the face to the pinna, while the cellulitis, which is spreading inflammation of the cutaneous tissue, it stops short of pinna because of close adherence to the skin to cartilage. Next is the Maller sign, a steady increase of pulse rate without corresponding increase of temperature seen in thrombosis. Next and the last sign today's video, man sign synonym in Graves' disease, the two eyes appear not to be on the same level. Man sign.